So this, sometimes it's just easier to see. Just to kind of give a little refresher, Vascade is the only closure device that's been proven safer than manual compression. We did a randomized clinical trial. It was prospective, multi-centered. We had 420 patients. This was against manual compression, Vascade manual compression. We had 0 major complications and only 1.1 minor complications. And again, it's just, you can see as I kind of scroll down, against manual compression and some of the other devices out there where we are. So most of every other one of them have had major complications, but then if you go down to the bottom, you can see Vascade, again, only had 1.1 and minor complications and no major complications. Secondly, the device is very simple to use. Clay will go into this a little bit more, but basically it's just a femoral access closure device. We have arterial and venous for access sites 5 to 7 French. I think you'll be able to see here on this picture, just kind of the disc sits up against the venotomy. And again, Clay will go into this a lot more. But the disc sits up against the venotomy, the collagen's exposed, and then the disc is collapsed and it gets removed through the collagen. And the only thing that's left in the body is the collagen. And that's only for 30 days, as it will be bioabsorbable, or it is totally absorbable. You can just see this slide talks about the expansion, so that the collagen hydrates to 13 times its size and it just sits in the tissue tract, and it really just starts that hemostasis period. Then the last part of this is that we offer this program. It's a risk sharing program, and truly we kind of put our money where our mouth is. We have such few complications, but we do offer it. It's the hospital, there's no like minimum monthly spend that there has to be, but basically Cardiva would reimburse UMass up to $1,000 per complication that they had, just because we truly feel like the device works all the time. So if there is anything going on, we want to be aware of it. Then let me see if I can stop sharing my screen. Hang on. Okay. Oops, Claire, are you still there? Sorry, I'm trying to. Oh, stop. Okay. Then the last thing I wanted to say was just that you can use Vascade in bifurcations. You can use it in the presence of calcium. It's been tested. We did an antegrade study, and we had a 98% success rate with the antegrade use of Vascade, and it was great. So just to kind of keep that in mind, you can use it. Carrie Ann just said that you guys have the angioseal and perclose, so certainly perclose if you're closing those very large holes. But you can almost use this where you wouldn't necessarily use angioseal again in a bifurcation, or if there was any type of calcium. There's no pain for the patient either when it's deployed, which is really nice. And they can get up and ambulated within 2 hours. So I think, do you guys have any questions? If not, I think Clay will go over then just kind of the deployment and the anatomy of the device. And if you guys want to follow along with the devices that you have, that's great. And you can ask us any questions along the way. I guess go ahead, Clay.
Good morning, everyone. I'm Clay with Cardiva, as Lauren said. So I'm just going to give you first a quick rundown of the device itself. If I'm close enough, you can see. So this is the distal tip. This is where the nitinol disc is that we open. It's covered with polyurethane. From there, we have the locking sleeve that goes all the way up to this white part. As you can see, if I try to move it, I can't. It stays pretty well in place. This first white marker on this locking sleeve is just a good indicator of where the collagen stops. So the collagen is underneath this locking sleeve from the, let me get this to stop moving, from the disc to this white marker, okay? Now after the lock, part of the locking sleeve, we can go to the key, which is back here. All the key does is just open up the lock and allows that sleeve to move back once we know that the collagen is where we want it. So we'll push this back. Back here is basically our silver handle. This is basically where we hold the device while deploying. And back here's our black actuator. And to open the disc, we hold both of these and we pull until we get that nice click. And then you can see there's the disc open. Obviously this one's a little damaged from overuse, but basically opens the disc. So first things first, we always want to get an angiogram of the of where the sheath is, to where the where the markers are on the artery. We obviously don't want to close anything that's too high, anything above the inferior gastric. So first things first, take the groin shot. When you know that you want to proceed, we flush the sheath. We open up the device. We always want to check the disc by, again, pulling the two apart. We look at it, want to make sure that the disc is nice and symmetrical. And then right before we go in, we just dip it in some saline for a second. Then right into the sheath. So we hold it like a pencil, short strokes all the way to the lock that I told you about. And now is the part where we just open the disc. We take the sheath and we pull back on the device with the sheath. And as soon as we see the device, we can grab it. And then the sheath comes all the way off. And then right hand is back on this silver handle, like so. And all you want to do is just bring it up against that arteriotomy until you get that nice hemostasis. Just temporary hemostasis, of course, but that just means that that disc is up against that arteriotomy. So once we have that, we bring the key into the lock, grab the lock, which now pulls back that locking sleeve, now exposing the collagen, because we know where the collagen is, right where we want it, and we let it grow for 30 seconds. Now after that 30 seconds, all you want to do is take this green push rod and separate the collagen from the device. All it needs is a couple times. You leave it in the down position. Get ready to hold arterial pressure with your left hand. Relax the tension. Do a pin cap on the end of the device, which just lets the disc down, and then we're out with the device. So we hold for 5 minutes, or until hemostasis. Any questions about that? I can go over it again.
Carrie, and I don't know if people are able to kind of practice deploying with the training material that I sent.
Let's see if I can find one that doesn't have a messed up.
Yeah, they're in there now practicing with
Yeah, this looks better.
Okay. Does anyone have any questions? I think it takes a couple times to just kind of get used to it, but they've probably been using it for a while. Clay, do you want to talk about the fluoro and clipping?
Yes. Good idea. So if you're worried that the disc is maybe hung up into a side branch and you don't think that you're back far enough, what you can do is open, once you're at the stage where you have the disc open and you've come out and you're not sure where you are because you want the collagen right at the other side of the artery. So all you do is take the clip that comes with it, hold that in place, and then you just take the patient under fluoro at the exact same angle at which you took your shot. And you can see those two beads. I'll show you. These two beads that are on either side of the disc, those are both very radiopaque. You can see them very clearly, and you want to just match it up where the insertion site of the sheath is into the artery. And once you feel like it's in the right spot, go ahead and take the clip off, key into the lock back, and then you want to, again, expose it for 30 seconds. Get ready to hold, and it comes out.
If you guys, I don't know if you're using these to close any